So radiation has become a huge concern, both with the general public and within the medical community. And we take many steps here at Good Samaritan Hospital Medical Center to ensure that patients get the most diagnostic quality images using the least amount of radiation possible. And we do that in many ways. From the patient's perspective, when they come in and have the actual scan, we have a whole technology side of our efforts. We use the most state-of-the-art software to make sure that the machine itself delivers the least amount of radiation to a patient. We specifically train and work with our technologists to make sure they know to scan the least amount of a patient's body, because it's not just what the machine can do, it's how people program the machine. So we make sure we're not over-imaging, we make sure we're not going through more than once. But we also have a special radiation reduction committee in our group where we review all protocols to make sure all of our technical parameters are what we need to have to ensure the best quality with the least amount of radiation. We also have resources for patients, websites such as the Image Gently campaign and the Image Wisely campaign for adults and for children, where they can do some more research on their own. We also do outreach education with our physicians, where we have traveled directly to physicians' private offices to review radiation safety information, to let physicians know, well, what is really the potential risk from a CAT scan from the amount of radiation we're giving? What should they be telling their patients? And then we offer clinicians a whole list of questions they could be asking themselves to make sure this is the most appropriate. And we encourage our clinicians to call us directly. 24/7, we have one of our radiologists on staff here that can talk to anybody at any time. So one thing we also give out in our department are wallet-sized imaging record keepers, so patients can just know what exam they've had, where they've had it, so they can locate it. And then we can really work together to minimize the radiation exposure. But I believe one of the most important things that patients can do is to keep track of their prior imaging. So many times we see something and we don't know if it's a problem that's new, or if it's been around a long time and we don't have to worry about it. And we'll recommend a follow-up study. If they've had something in the past, it may be on there and we can eliminate that.
We're the only institution or outpatient or inpatient in the region that provides pulsed fluoroscopy, which what that means is that there's intermittent radiation significantly decreasing the radiation dose in children. When you combine pulse fluoroscopy as well as screen-save feature during the examination, which limits the actual x-rays being taken during the procedure, thereby limiting the radiation dose during the exam by 20 to 50 times of what it would normally be. In addition to providing outstanding radiologic care to children, their parents, physicians, and pediatric clinicians, we also have a unique relationship with the physicians and clinicians at the Good Samaritan Hospital Pediatric Specialty Care Center. Here at Good Samaritan Hospital, we understand that children are not just miniature adults.